Good afternoon. Thank you for joining us at today's press conference. My name is Allison Glass, and I am the State Campaign Director with Amplify Georgia Collaborative, a Southern-led collaborative working to advance reproductive justice in Georgia. Today we are standing together to expose anti-abortion centers, often misleadingly known as crisis pregnancy centers. These unlicensed and unregulated centers disguise themselves as healthcare facilities, targeting vulnerable pregnant people seeking care. We call for an end to the state's support of these fake clinics that mislead Georgians and take public dollars away from real maternal health care that is so desperately needed in our state. Amplify Georgia, in collaboration with our partners at Spark, Access Reproductive Care Southeast, Sister Love, and Urge, are here to demand accountability and push for the passage of HB 488 and Senate Bill 196, the Pregnancy Center Fraud Prevention Act, to stop the deceptive practices of these centers. We are also advocating for HB 489 and Senate Bill 197, the End Misuse of Public Funding Act, to end the state's $2 million per year investment of taxpayer funds into these fake clinics. And finally, House Resolution 274 and Senate Resolution 207, the Fund Healthy Pregnancies and Parenting Resolution, to shift money away from anti-abortion centers to programming that supports maternal health care and supports new parents. With that, it is my pleasure to introduce our speakers. We will first welcome our legislative sponsors, Representative Ann Allen Westbrook and Senator Nan Orrock.
Good afternoon, and thank you so much for joining us today. My name is Ann Allen Westbrook, and I represent Georgia House District 163 in Savannah and Chatham County. Thank you for being here. We are here today to stand with Georgians in their right to accessible, evidence-based health care. Georgia's families are facing a crisis of health care inaccessibility. We live in a state where 82 of our 159 counties have no OBGYNs, where 67 of our 150 counties have no pediatricians. And Georgia has among the highest rates of maternal mortality in the United States, with Black women in Georgia dying during the postpartum period at 3 times the rate of their white counterparts. And we live in a state with an extreme abortion ban. Our state's 6-week ban deprives Georgians of decision-making over their bodies and their lives by preventing them from accessing the health care they need, including abortion. Georgia's Maternal Mortality Review Committee found that Georgia's abortion ban was responsible for the deaths of Amber Thurman and Candy Miller, both mothers who left children behind. Georgia's crisis of health care and abortion inaccessibility is costing women their lives and children their mothers. And yet, while Georgia families have barriers to accessing reproductive health care, prenatal care, and pediatric care, unregulated crisis pregnancy centers proliferate in Georgia. These centers are nonprofit, usually faith-based facilities dressed up as reproductive health clinics. They do not provide, however, the range of services a medical provider would, including contraception, sexual health treatment, or abortion services. Instead, they counsel pregnant people against abortion. They often engage in deceptive practices, first to bring people into their centers, then to pressure or mislead them out of seeking abortions. They are unlicensed and unregulated. They are not bound by HIPAA and are not required to provide factual, unbiased medical information. And in a state where, again, because it bears repeating, half our counties have no OBGYNs and no pediatricians, these crisis pregnancy centers are funded by our tax dollars to the tune of $2 million annually. These centers should not be allowed to deceive Georgians about the services they offer, and Georgia taxpayers should never have to foot the bill for deception. And so I am proud to announce today that we filed 3 pieces of legislation. HB 488, the Pregnancy Center Fraud Prevention Act, which requires facilities to be transparent about the health care they provide and prohibits them from falsely implying that they provide abortion or prenatal medical care if they do not. HB 489, the In Public Funding of Misinformation Act, which would repeal the grant program for these anti-abortion centers and return the $2 million in state funding that they receive annually to the general fund, where those dollars can be used for real health care. And finally, H.R. 274, the Fund Healthy Pregnancy and Parenting Resolution, which urges the redirection of the $2 million in state funds used for anti-abortion centers to instead support the Georgia Home Visiting Program, an evidence-based program that provides home visits during pregnancy and early childhood to improve birth outcomes, reduce preterm deliveries, and decrease infant and maternal mortality. Pregnant Georgians deserve access to accurate information and evidence-based health care, and all Georgians deserve to see their tax dollars invested wisely in ways that help our state thrive, not in misinformation. So thank you for your attention today. It's my pleasure to turn over the mic to Senator Nan Orott. Thank you.
Thank you, and thank you all for joining us today. I feel like Pauline Revere, right? Spreading the news. Georgians don't realize our tax dollars are being used to fund fake clinics. That's the bottom line. And it's been going on far too long. I remember the first time they put the $2 million in the budget, and they were off to the races, funding fake clinics that are not regulated by any laws of commerce or by any medical requirements. And they have people running around in white coats talking to women who are seeking solutions to an unplanned pregnancy, and they're talking them out of the solution that they came there to seek. And they're doing it with our tax dollars. So Georgians have a right to understand the full range of pregnancy options and to receive reliable medical information without political bias. These fake clinics were set up and they're spreading all over the state, and they're numbering almost 100 now. You'll see them coming up this year asking for more money. Oh, they say we want 10 million now. 2 million's not enough. 10 million to fool women, to lie to people seeking pregnancy services, to be actually blatantly violating the law, but there's no regulation. There's no requirements that they have to meet. There's nobody overseeing them, and there's no accountability, and they're posing like they're presenting medical options and medical advice and medical information. There ain't a doctor in the house, y'all. Those folks running around in white coats have no credentials to be doing what they say they're doing. It's time to unmask this charade, to defund and close down these clinics. Well, they can keep running, but they've got to stop their false advertising, and they've got to stop getting paid with taxpayer money, and they can maybe figure out another way. But we're saying fund real clinics to meet real health needs. Georgia has plenty of high needs counties. We have a great program that our public health department runs for home visitation for new moms and infants. We need to be doing that in many more counties. It's in the high need counties right now in South Georgia. We need to be expanding that. We can take this money and put that to good use, providing genuine health services that are overseen, that meet medical standards, and that tell the truth, not lies, to pregnant people seeking assistance. The real solution, you have healthy mothers, that paves the way for healthy babies. So we need to be getting the mothers, expectant mothers, into healthcare services much earlier than they come now. They often present very late because of the lack of OBGYNs around the state, the lack of medical services, particularly in rural Georgia, and the lack of full coverage for the costs of that. So we're calling with our bills. We have, I'm so happy to be partnering with Representative Westbrook in the House, who has given you a very articulate explanation of what our bills do. In the Senate, it's Senate Bill 196, Senate Bill 197, and Senate Resolution 207. We have filed these bills in the last 24 to 48 hours. We're going to be calling on the House and Senate leadership to bring these bills up in committee to review these bills. We'll be calling on the Budget Committee to do the right thing, and we have a bill that will close down these clinics. We have a bill that will force them to come under regulation. We have a bill that would move a resolution that would propose to move the money out of these fake clinics and into real clinics, into real programs that help pregnant people who are looking for services. We thank you for your support. We'll take questions, but we're going to hear from some folks that have been directly affected by these fake clinics. And they put up signs that make you think if you come to us, you're going to get great services. You're going to get medical services. You're going to get everything you need. And what they get is a lot of preachifying and some tale telling. They're not straight shooters, y'all. This is deceptive advertising, unregulated practice, and we need to put a stop to it. We need doctors, not deception. We need to close fake clinics, and we need to open real clinics. Thank you so much for your attention, and we're going to bring forward others who have confronted this in real life right here in Georgia. Thank you.
Thank you so much, Representative Westbrook and Senator Orrock, for your support. We will now be joined by two community advocates. Julia Callahan is a mother of two toddlers, a small business owner based in Macon, Georgia, and the co-founder of Middle Georgians for Choice. And then Agbo Ikor, the Policy and Advocacy Director at Spark Reproductive Justice Now, and the chair of Amplify's campaign to regulate and defund these anti-abortion centers. Julia?
Hello everyone, my name is Julia Del Callahan and I am a mother of two, a small business owner, and since my pregnancy, a reproductive justice activist based out of Macon, Georgia. My husband and I found out that I was pregnant in July of 2021. I miscarried one of my twins 3 days later. In all of our ultrasounds, we were still able to see our twin that had passed, and we were heartbroken. My pregnancy Medicaid only covered a limited number of ultrasounds, which means any more would have to be paid out of pocket. At 7 months pregnant, I asked around where I could find a new ultrasound or get a new ultrasound. A church friend told me that I could go to the Colby Center and get one for free. So I made an appointment. I was so excited to see my miracle baby girl. That day, I walked into the center, sat down, and filled out new patient paperwork. I chatted with nurses, or who I thought were nurses, and got escorted back to a room to have my ultrasound done. Two women came in and introduced themselves. One of the women explained to me that she was training a new ultrasound tech who would also be conducting ultrasounds at the center. I said great and gave them my belly. They gave me what resembled an anatomy scan. We looked at all the fingers and toes and the face of my beautiful baby girl. They got started looking at the baby's organs, and they got quiet on me. I could feel the mood in the room change. The baby's kidneys are full of fluid. Do you have an OBGYN? They printed a long ultrasound and sent me in shock and tears to my OBGYN. I had such a physical reaction that I threw up in the parking lot. We had already lost a baby. My family and I desperately wanted this pregnancy. We were all terrified. I brought my ultrasound to my doctor and tearfully explained to him what was told to me at the Colby Center. He reassured me that nothing was wrong with my pregnancy and explained to me that I was in a crisis pregnancy center. I had no idea what a crisis pregnancy center was, so as soon as I got in the car, I opened their website. It said that this was a pregnancy clinic and that these people were providing medical care by healthcare professionals. The people had described themselves as ultrasound techs and nurses. I sat in disbelief as I processed that I had been deceived by people who I had trusted to take care of me during one of the most vulnerable times in my life. That's when I got a Facebook message from one of the women who gave me my ultrasound, which is a huge violation of privacy that would never have happened at a real healthcare facility. She didn't seem to understand why I was upset. They gave me false information about my pregnancy during a training. If they were medical professionals, this would be considered malpractice. But because crisis pregnancy centers are unregulated in Georgia, there is no legal recourse for me to hold these fake clinics accountable. The irony in all of this is that they could have caused me to lose a perfectly healthy pregnancy. In Macon, we have 3 fake clinics and 7 overall in Middle Georgia. Yet, there are zero comprehensive reproductive health care centers, and we are surrounded by a maternal health care desert. They all have similar advertising practices, falsely claiming that they provide medical care in a region that lacks access to this care. What I went through was very traumatic for my husband and I, and I don't wish this experience on anyone. Pregnant people should not have to be worried about being deceived to get people in the door, nor should they be given inaccurate health information from non-licensed providers. Thank you guys for letting me tell my story today.
Hello. So great to be here. So good afternoon. My name is Agbo Ipor, and I am the chair of the Fake Clinic Suck campaign, as well as the Policy and Advocacy Director for Spark Reproductive Justice Now. I am so excited and grateful to be up here representing this campaign and the incredible work these organizers have done over the past few years. This campaign has been a long-term effort to address the harmful fake clinics in our state. We don't want facilities lying to pregnant people about the services they can access or will be provided, period. Especially if these facilities are being funded by our tax dollars. Every year, these fake clinics receive millions in taxpayer dollars, while Georgia ranks among the worst states for maternal health. That money should be funding real care, not deception. Repealing that funding is just one step in mitigating the harms of anti-abortion centers in Georgia. This other important piece of legislation aims to prevent fake clinics from lying about the services they offer. The Pregnancy Center Fraud Prevention Act aims to prevent these facilities from lying to patients and clients about what health care is available to them. We must pass legislation to mitigate the harms that these fake clinics perpetrate and ensure that our tax dollars are no longer funding them. We urge our lawmakers to support these pieces of legislation, and we urge the public to reach out to your lawmaker and ask for their support. Thank you already to our lawmakers who have already signed on, who have already sponsored. And if you're interested in stopping these fake clinics, we urge you to sign our petition. Just go to tinyurl.com/StopFakeClinicsGA and sign our petition. The other large part of this campaign is demystifying these fake clinics. Many people are unaware of what fake clinics are and how they operate, and that's why they're so successful. We hope to educate the public about these facilities, and the media plays a large part in that. And we urge the media to cover this very important issue. If you have an experience with a fake clinic, we want to hear from you. You can share your story at tinyurl.com/FakeClinicTrueStory. We want to hear from you. If you want more information about the campaign or any of our other efforts, I encourage you to follow Spark Reproductive Justice Now on Instagram and Amplify Georgia on Instagram. Thank you.
Thank you so much, Julia and Agbo. We will now take any questions from the media. We are also happy to field questions after the press conference concludes. Thank you so much to our brilliant and brave speakers, to our legislative champions, and to everyone who came out today to show your support for these 3 pieces of legislation to end the deception of anti-abortion centers and to instead invest public funds toward real maternal health care. When someone is pregnant or thinks they might be, they deserve truth in their health care that they can trust. Privacy, dignity, and honesty from providers is essential in every healthcare journey, and we urge our lawmakers to take immediate action against these unlicensed and unregulated fake clinics. Thank you very much.